I ask patients to obtain clearance from just our preoperative clearance team. And sometimes they may recommend that the patient see a cardiologist or any other related specialist, which allows us to administer anesthesia to the patient. In addition, they need to have good control over their glucose. So my cutoff for hemoglobin A1C is 7.5. We always work with our patients to make sure that we get the appropriate paperwork filed before, in order to undergo clearance, and we will not proceed with surgery unless the patient receives approval from their insurance company. Yes, the patient will need to arrange for transportation because you'll be receiving general anesthesia on that day, so somebody needs to drive you in to take you home. So we ask you to stop your blood thinning medication depending on the type of medication you're on. In addition, we start a antibiotic wash 3 days prior to surgery. Leading up to surgery, we recommend that you don't shave yourself leading up to surgery. We will take care of that once you're under anesthesia. You need to stop eating or drinking at midnight prior to surgery, and you'll get specific instructions related to that. On the day of surgery, you'll actually not be spending a whole lot of time in the hospital, so you'll go home the same day. So just bring your routine things that you need as far as your eyeglasses, and if you do have dentures, then just be able to remove that. Also remove any jewelry that you may be wearing. On the day of surgery, when you come in, you'll be greeted by our front desk and brought back to the perioperative area, where you'll be asked to change in the hospital gown. You'll remove all your jewelry and valuables at that time, and you'll meet the rest of the team who will explain the procedure to you one more time. And once all your questions have been answered, then we'll roll back to the operating room and the surgery will be performed. Yeah, it can be, being nervous can be, it's a very common thing that we see in patients who are undergoing a procedure like this. And it's not uncommon that many patients have not had any major surgeries leading up to this procedure. And the most important thing is to just make sure that you ask all your questions to the providers, and you make sure that there's no reservations related to any of the steps of the procedure. And as well as post-operatively, if you have any questions related to that, make sure that you address that before. When you come to see us, you'll actually get contact information for our clinic, and that'll have a direct line to my team. And if you have any questions, feel free to either contact us through that number or through my chart.